Hi, I'm Dr. Marion Owen with Whole Family Medicine, and I'm going to talk to you today about the importance of exercise and the dangers of being super sedentary. This is something that a lot of us struggle with, finding the time to do the exercise that we know we need to do. So I want to talk to you about why you need to do it, and then I want to talk to you about ways that can make it fun, ways that you can work it into your life. So the dangers of a sedentary lifestyle are huge. Being sedentary increases the risk of some cancers, lung cancer, endometrial cancer, some colon cancer, all increase in people who are sedentary. Sedentary people are at increased danger of a lot of emotional issues. Anxiety is worse when we don't get exercise. Depression is worse. In fact, depression has been shown to be resolved just as well with a daily 1-hour walk as with any of the medications I can prescribe you. Also, just mental sharpness. The longer you've been seated, the less sharp you are, and so you might notice that as you drag through the day, you get less and less effective at work. So getting up and moving around can really help with that. And then there's all the things we already know about in terms of health: cardiovascular disease risk, increased blood sugar problems, insomnia, more aches and pains, especially low back aches. All of these things increase as we're sedentary. And very importantly, and something you might not know, being sedentary affects your sex drive. It makes you less interested in sex, and it increases your sexual dysfunction. So if that doesn't motivate you, I don't know what will. So what's the solution? The solution is to be non-sedentary, to exercise. It's the easiest thing to say, and for a lot of us, it's the hardest thing to do. So how do you work it into your life? We're all trying to slam about 40 hours of activities into a 24-hour day. We're sacrificing sleep, we're sacrificing nutrition, we're sacrificing exercise just to get everything done. So how do you squeeze it in? Well, the first thing is find an exercise you like to do, because that will motivate you to fit it into your life. If you like to go to a class where there's friends, go there. If you like to go running, try to work that into your life, whatever you enjoy doing. And then I'd encourage you to think about what motivates you, what makes you want to do something. Is it putting up lists of things that you're trying to avoid? I don't want to become a diabetic like my grandmother, or I don't want to have a heart attack before my children graduate from college. Whatever motivates you, put those signs around. Remind yourself why you want to do it today. For some of us, it's really important to make it social. Go on a walk with your spouse, process your lives together, go on a walk with a good friend, talk about things that you enjoy. Incorporate hiking or bird watching or whatever you like to do. Move that into being active. For some of us, we're very motivated by competition. That would be me. Growing up with two older brothers who were always challenging me to do things, I really respond to that. And so I have a friend, and we're challenging each other to do the most 7-minute workout. So the first 1 to 30 wins, and we haven't decided what we win, but it's just important that one of us wins. So if that works for you, set that up for yourself. Make it something that you have to get done before you get to reward yourself with something you look forward to at the end of the day. I can't watch my favorite show until I've done a 30-minute walk. So once you've decided to do it and you have your motivation in place, what's the most effective form of exercise? Well, the most effective form of exercise is the one you do. So if there's whatever you like to do, do that. Exercise is something you should think, I do this every day. I know that the Heart Disease Association says 3 to 4 days a week, 45 minutes at a time. Well, we all know that when we aim to do something 3 to 4 times a week, we end up doing it twice. So if it's something that you consider, I need to work this into my everyday, I put it before work, I put it at lunch, I put it right after work, I put it after dinner. Whenever you're putting it into your life, put it in there every day, and it's much more likely to happen. Challenge yourself to do 2 minutes at least at the highest intensity you can of something. So one exercise that's really great is burpees. You jump up, you drop to the floor, you do a plank, you jump back up. That activity is really hard to maintain without really maxing out your energy expenditure. And if you're only going to do 2 minutes, you want to be maxing out your energy expenditure. So burpees, jumping jacks, running up and down the stairs, whatever works for you. Your goal is that you do that for 2 minutes a day, at least, intensely. And there is some good data that 2 minutes a day at high intensity is equal to the cardiovascular benefit, at least, of 45 minutes of moderate activity. So that's my advice on exercise and the importance of not being sedentary. If you have any questions or you need help getting motivated, give us a call.